Hey, everybody, welcome to the live stream. I'm really excited about this conversation. We are connecting with some of our team out in Muskegon. Yes, you heard that right. Mary Free Bed has an outpatient location in Muskegon that's serving patients out there along the Lakeshore. We've got two great employees from our team that are joining this conversation, Dr. McKinney and Megan. Dr. McKinney, why don't you just introduce yourself and tell me how long you've been working at Mary Free Bed?
Sure. I'm Dr. McKinney. I am a physiatrist at Mary Free Bed, and I've been here for 6 years.
And Megan, what about you?
My name is Megan, and I am an occupational therapist that has been out here in Muskegon for about a year and a half now.
Awesome. Well, thank you for taking the time, breaking away from our patients to chat today, to educate, and just let people know how we're serving people along the Lakeshore. Dr. McKinney, can you just tell me a little bit about where within the city is your location?
Sure. So we are located in Norton Shores. We're on the corner of Pontaluna and Harvey, and we're attached, to the Cancer and Hematology Center right next door to us.
Yeah, I got the picture of our building right here. You can see it's a nice big green sign there so people know where we are. Megan, what's it like, you've got people from around the community that come and work with your team. Where are some of the people driving and commuting from to come work with you guys?
Yeah, we have a lot of people from all over West Michigan that come, even commute from Grand Rapids, Fremont area, north of Muskegon kind of places, but we even have locally. So we'll get a lot of pediatric patients, even from Shoreline Pediatrics or Port City Pediatrics, Trinity Health Hospitals, and all of that as well. So it's nice to have a good community that we can refer back to. But also getting it just from the whole west side of Michigan, even southern part as well on the Lakeshore. So it kind of all develops around this area. And so it's nice when people are finally knowing that we're here.
Yeah. We hear about the Grand Rapids location, the hospital, but to just know that we've got so many locations around the state that we can serve and help people to make it convenient for them. So Dr. McKinney, go ahead.
Sorry. The other nice piece to that is that because we're all interconnected, if we find that a patient would be better served at one of our closer sites, or if somebody's going downtown and they actually live closer to our site, we'll help direct them to what would be easiest for them to get to.
Yeah, and everybody's got their own unique specialties too. So when you work with a clinician that you really like, it's nice to keep that relationship going or find what's more convenient for you. So Dr. McKinney, you introduced yourself as a physiatrist. What is that, and what's your work within rehab?
Sure. So it's not a very well-known specialty to the community. You'll hear us referred to as physiatrists or PM&R doctors, which are physical medicine and rehabilitation doctors. Really what our role is to assist people that are having some sort of functional deficits. And that's a really broad term. So many things can cause people to not be able to do their day-to-day activities or things that they enjoy. And as physiatrists, we see those patients with what I call a conservative toolbox. Mm-hmm. So we're using things, really anything other than surgery. We're using different things such as therapy modalities, medications, injections, psychology support, all to help optimize the patient's level of function and get them back to doing the things that bring them joy.
Yeah, it's very multidisciplinary, very almost holistic approach, looking at all different aspects. And one of those pieces and tools is occupational therapy.
Right.
And so Dr. McKinney, what are some of the different types of patients that you work with and you see? What are those diagnoses that are coming to work with you?
It's truly a broad range. I think if people know about physiatry, the very typical diagnoses that you hear about are things like stroke, a spinal cord injury, traumatic brain injuries from auto accidents or motorcycle accidents, amputations. So we have a large amputee clinic here on the Lakeshore also. But really, it's a very broad net that we're able to treat, because if you think about functional deficits, that's people that have had maybe multiple spine surgeries and are really struggling with pain or mobility after those surgeries. People that have had cardiac surgeries or interventions and are really just deconditioned. Or even those that have had cancer with chemotherapy, or things that have brought on new pain issues or endurance issues. We're able to treat all of that. So there really is no diagnosis we wouldn't see. If you're struggling in any way to be doing the things day to day that you enjoy or keep you independent, we're happy to see you.
And another term that some people might not necessarily fully understand is occupational therapy. And it's just okay, you're going to help me find a job. Megan, what is occupational therapy, and how are you working with the patients that you see?
Yeah, a lot of times when people hear occupational therapy, they think, oh, occupation, job, career, getting back into that. Well, I don't really have a problem with that right now. I have a hard time with even being able to dress myself or tolerate going out into the community. So why do I need OT? What is that going to do for me? So I always give a little giggle and laugh when they come in. I'm like, okay, I'll explain about a little bit about what we do and the difference between PT and OT even, right? So occupational therapy focuses a lot on getting people back into doing their everyday tasks. So it could be their routines for in the morning, getting dressed, bathing, toileting, but it can even go a step farther. It can go into doing your favorite hobbies, grocery shopping, even grilling out and having people over for barbecues, and then getting into doing recreational tasks as well. So it could be doing, getting back into tennis or golfing, doing those big activities where you're going into your grandsons or granddaughters' games and celebrating your family and being able to do holidays together. So we work a lot on range of motion and kind of rehab with people when they have difficulties with like shoulder rotator cuff injuries. That's a big one that OT deals with. It's kind of going from waist up as PT does waist down. So you can see, different pictures of how PT works with the gait, jumping, balance. And then OT would definitely touches more on kind of working on the upper extremities and getting you back into doing functional tasks.
Megan, do you want to talk a little bit about the FCEs that we're doing here now too?
Yeah, definitely. So there is a part of the work hardening and getting you back into doing your job. So FCEs are functional capacity exams. And what that does is kind of test, okay, how much are we able to lift? How much are we able to bend? Can we do that repetitively? How many times are we able to do that? And through the evaluation, occupational therapists are able to look and see, okay, this person can maybe do it rarely, occasionally, often, or all the time, or just maybe not at all. So kind of limiting and giving restrictions for jobs to look at, and also doctors to be able to advocate for the patient as they go into their new job or the same one that they had before, and saying, okay, maybe we need to make some modifications, adaptations, or what can we do to help serve you better as a patient within this healthcare and community and within the job community as well.
Yeah. So some of those back to work patients you've worked with, but what are some of the other types of people, like specific ones that you almost even get like excited? Okay, here's this patient who's got this problem and I'm going to jump in there and help them solve it. What are the types of patients you work with?
Definitely. Yeah. So I've been working with adults for a long time while I've been here. And some of my favorite are post-stroke patients. So it's a lot of fun to be able to develop new skills and relearn some of the skills and maybe do it a little differently than they did before. Maybe they have some new interests. And so kind of working to navigate and see how can we make everything work again, but do it in a way that they're so involved and motivated and it piques their interest, because a lot of times your interest can change. And so, or motivation changes a lot. So kind of navigating that sequence. And then I've been getting a lot of pediatric patients now that we started the pediatric program here. And so a lot of the good challenges for me are emotional regulation or sensory processing difficulties. So focusing a lot on, okay, having difficulties with transitioning, or maybe we're having a hard time with routine. Emotional regulation is having a hard time with, dealing with different kids and maybe socialization aspects. And then sensory processing with going into a little bit of difficulty with tolerating maybe different foods, smells, overcrowded areas. It can be overstimulating for different pediatric patients. So working on a lot of different aspects that way.
And it's not just physiatry and occupational therapy that are offered at your Muskegon location. What are some of the other services that are a part of it and available?
So really the goal when we opened this clinic was to have a site available that provided all of those tools in our conservative toolbox, like I talked about earlier. So we offer a ton of services here on site in Norton Shores. We have physical therapy, occupational therapy with those FCEs like Megan talked about. We have a speech therapist here. We offer psychology services, although they are virtual. We also have, we have a physiatry team here to see you for your medical needs. And we also have an injection suite where we do offer peripheral joint injections, Botox injections, trigger point injections, and spine injections. So we do everything here pretty much except the surgical part. So whatever you need, we should have you covered.
Yeah, I like how you say conservative toolbox there. Megan, how does occupational therapy complement that? So you might not just come in just for occupational therapy. You might come in for PT and OT. How do the disciplines work together to help solve patients' problems?
For sure. Well, one of the differentiating factors I feel like for the outpatient Muskegon office is that we actually have the med group and we have the therapy side all together in one building.
Mm-hmm.
So we're able to really kind of bounce ideas off of each other and communicate effectively for that quality patient care. So that's a big aspect that I think differentiates us. But even differentiating between the different therapies is important as well. So, with PT and OT, a lot of times people will focus on treating the person as a whole. And so I may be working on the emotional, spiritual, and mental side, as well as some of the physical, where PT is also really focusing and working on that strengthening endurance. So that way we can get back into doing OT for those physical and functional activities that we want to get back into doing. So PT and OT definitely complement each other for coordination, balance, because a lot of times, let's say you want to do an activity such as washing dishes in your sink. Sometimes that will require you to stand for an extensive amount of time. So PT will have to work on that balance, coordination, and standing for increased endurance. Or OT kind of takes that reins of, okay, what can we do to help our shoulders, good posture, body mechanics, and being able to do an activity safely. Where with the speech and OT, we focus a lot on like sensory needs, where OT will focus kind of on different textures and tolerating those different sensory aspects. And then SLP will go in, which is speech, will go into doing more of the consumption and the intake of food and the swallowing, being able to ingest.
Dr. McKinney, sometimes people might be a little scared, like if their doctor would refer them and like, okay, you got to go do some outpatient therapy. Like, why might they be nervous, and what would you say to them to help make them feel more comfortable?
I would say the biggest barriers when people are confronted with maybe needing to get some outpatient therapy is the fear that either it will make their pain worse or that they won't be able to tolerate that therapy. And that's truly a discussion we have almost daily with the patients here in the office. And the big discussion that we have is that the relationship between a patient and their therapist is so critical to the success of them reaching their goals. And the communication is very important, because if you leave therapy and you're paying for it the next day, it's not effective. And so you need to go back and talk with your therapist, and all of our team knows and is open to this communication. Hey, that was a little bit too much yesterday. Can we find a different way to attain these goals and maybe not have these side effects from the therapy? So communication is key, and our team does that fantastically. So patients are feeling much more comfortable once they meet their provider.
Yeah, that's great. That's just, you hear so much about that connection between the patients and their therapists or their doctors that really helps make it just work at Mary Free Bed. Any other kinds of like misconceptions or myths that there might be about rehabilitation that you have to sometimes help, back check?
Yeah, I would say one of the things is that all therapy is the same, or that I've tried therapy once in the past and it didn't work, so it won't work in the future. And the way that I think our team looks at rehabilitation is that it is a team sport. It's not one thing. So I'm not going to send you to PT and the PT is going to fix all your problems. We're going to work together in a multidisciplinary approach and include things like medications, if appropriate, injections, maybe some manual therapy. And that combination is unique for each patient. So not every patient's going to be treated in the same way with the same kind of ingredients. And we got to find what works for each person. So it's kind of breaking that thought process that, hey, I've done this before and it didn't work. Well, let's see if we can do it with a couple extra ingredients here and if we get a little bit more success out of it.
That's excellent. And as we start to wrap up this interview, Megan, do you have any like recent success stories of patients you worked with that were really just, fill your bucket? Because you both seem very passionate about the work you do. Like, any stories that just you're excited about to share?
Yeah, I have namely a few that stick out. We had a patient here that we've done a lot of different different media coverage with, because she's been making such a difference and been such an influence for everyone in the multiple sclerosis community. And so kind of focusing on having someone that came in a wheelchair, could not regulate getting out of the wheelchair without having temperature irregulation or tolerate standing or tolerate even moving or transferring to a different mat table, to now working independently on her own, living independently and is able to take care of others, walk independently without use of a wheelchair, walker, cane, whatever. And she's been able to make such moves, big moves and bounds, that it's been so influential on not only us therapists, but also everyone that she affects and comes in contact with in the therapy world and in the community. So that was a heart touching. Yeah.
And the neat part about it too is that when Megan's working with a patient and they reach these gains, we're right here as the providers part of the team, and she'll come right over with the patient, knock on the door and open and show us exactly what has been accomplished in that session. And it's just, it uplifts the entire team because it's a team success. And you feel that a lot here in our office.
Yeah, that's so exciting. Well, thank you for sharing that. That's Sam's story, and we can make sure we put that in the comments so people can go back and watch it if they're curious of seeing that. So, Dr. McKinney, last question. If someone wants to work at, come work with your guys' team in Muskegon, how might they get connected or get a referral, whatever, to your team?
Sure. So the nice thing about the office is that we do, for physiatrists, accept some self-referrals. So if you wanted to just get involved with our physiatry team, you could just call up and Chris will put up the information for you here, and just call the girls at the desk, tell them what you're looking for, and we can see what information we need from you to get you scheduled. If you're looking to come in for therapy services specifically, you can ask your primary care provider to get the scripts over to our office. And everything is done electronically nowadays, so they should be able to take care of that. And our team will get a hold of you right away and get you scheduled.
Awesome. Well, Dr. McKinney and Megan, thank you so much for chatting with us today and talking about the wonderful work you guys are doing in Muskegon, along the Lakeshore, and it sounds like across the whole state. So thank you guys so much for watching. If you need any more information, you can go to maryfreebed.com. We'll also share the address and the phone number to the Muskegon location. Thank you for watching, and stay well.